Hello, welcome all. I am going to discuss about analgesia and classification of analgesia and treatment of analgesia. What is analgesia? Analgesia is derived from Greek words, means analgetos, it means without, and algesia, it means pain. So analgesia means the absence of pain without losing consciousness. And analgesia are a drug that selectively relieve pain by acting in the CNS or on the peripheral pain mechanism without altering consciousness. And analgesia is a lessening of pain or absence of pain, and it usually used in context of medicines as a more technical way of saying that pain relief. So analgesia refers to a remedy that reduces or relieves pain. Now classification of analgesia. First one, non-selective COX inhibitors, it is known as traditional NSAIDs. Different examples are, first one is salicylates, for example aspirin. Second one is propionic acid derivatives, for example ibuprofen and ketoprofen. Third one is anthracinic acid derivatives, for example mefenamic acid. Fourth one is aryl acetic acid derivatives, for example diclofenac and aceclofenac. Fifth one is oxycam derivatives, for example piroxicam and tinoxicam. Sixth one is pyrrole derivatives, for example ketorolac. Seventh one is indole derivatives, for example indomethacin. Eighth one is pyrazolone derivatives, for example phenylbutazone and oxyphenbutazone. B part is preferential COX-2 inhibitors, for example nimesulides and meloxicam. C1 is selective COX-2 inhibitor, for example celecoxib, rofecoxib, valdecoxib, etoricoxib. D is analgesic antipyretics with poor anti-inflammatory action, like para-aminophenol derivatives, for example paracetamol or acetaminophen. Next one is pyrazolone derivatives, for example metamizole and propionazole. Next one is benzoxazosine derivatives, for example nifopam. And NSAID'S and prostaglandin synthesis inhibitor or inhibitions. Prostaglandin and thromboxane are produced from arachidonic acid by enzyme cyclooxygenase, which exist in two forms like COX-1 and COX-2. It means NSAIDs and prostaglandin synthesis inhibition, it produces or it forms two types like COX-1 and COX-2. COX-1 is cyclooxygenase 1 and COX-2 is cyclooxygenase 2. Most NSAIDs inhibit the COX-1 and COX-2. Most NSAIDs inhibit the COX-1 and COX-2 inhibit the non-selectives. Some selective COX-2 inhibitors have now been produced. It is most important. Now, beneficial action due to prostaglandin synthesis inhibition. analgesia, antipyresis, anti-inflammatory, and antithrombotic. Now, toxicities due to prostaglandin synthesis inhibition: gastric mucosal damage, bleeding, inhibition of platelet functions. Next one is limitation of renal blood flow and sodium and water retention. Now next one is delay, prolongation of labor, and last one is asthma and anaphylactic reaction in susceptible individuals. Now what is the adverse effect of NSAIDs? Adverse effect of NSAIDs, first one is on gastrointestinal: gastric irritation, erosion, peptic ulceration, gastric bleeding, and perforation esophagitis. And adverse effect on renal, like sodium and water retention, chronic renal failure, interstitial nephritis, papillary necrosis. It is a rare. Now on hepatic, raised transaminase and hepatic failure. Hepatic failure is rare. Now on CNS, central nervous system: headache, mental confusion, behavior disturbance, seizure, precipitations. Now next one is hematological, like bleeding, thrombocytopenia, and hemolytic anemia, and agranulocytosis. Then others, asthma exacerbations, nasal polypsosis, and skin rashes, pertussis, and angioedema. Now what is the routes of analgesic administration? Oral, intramuscular injection, intravenous injections. Other routes like intradermal, for example fentanyl patches, and sublingual like morphine. And preferential COX-2 inhibitors like NSAIDs. NSAIDs is a weak inhibitor of prostaglandin synthesis. It indicating the COX-2 selectively, and it used for short lasting painful inflammatory conditions, and it completely absorbed orally. T half is 2 to 5 hours, and adverse effects includes agranulocytosis and gastrointestinal nausea, vomiting, and somnolence, dizziness, elevated liver enzymes. What is the dosage of NSAIDs? Is 100 mg BD. It is used for short lasting inflammatory conditions like sport injuries, sinusitis, and other ear, nose, throat disorders, and low back ache, dysmenorrhea, and for the fever. Now next one is para-aminophenol derivatives like paracetamol. Paracetamol or acetaminophen is a deethylated active metabolite of phenacetin. It came into common use since in 1950, and it is well absorbed orally, and T half is 1/4 is protein bound, and T half is the 2 to 3 hours, and effects after oral dose last for 3 to 5 hours, and it is safe and well tolerated. Adverse effect: acute paracetamol poisoning in small children with low hepatic glucuronide conjugating ability, and in large doses more than 150 mg per kg or more than 10 gram in adults. Serious toxicity can occur, and fatality common with 250 mg per kg. And what is the uses? Used as a common over the counter analgesic and one of the best antipyretics, and it comparatively safer than the aspirin. It is most important, and it is safest drug for the pregnant woman. Then what is the dosage form? 0.5 to 1 gram TDS in adults and 50 gram in infants, and 80 to 150 mg in children and 1 to 3 years old, and 240 to 320 mg in 4 to 8 years and 300 to 600 mg in 9 to 12 years. Thank you for watching this video. I hope you understand. Still you have any problem, you can comment. So we will continue rest of our topic in next video.